Welcome everybody, and welcome to today's WRLA webinar, Stress Busters. My name is Jessica, and I am the Trade Show and Event Manager for the Western Retail Lumber Association. I'm going to be your host and your facilitator today. So first off, I want to start by thanking today's webinar presenter, PIB, extended healthcare, dental benefits, and income protection insurance with PIB as your preferred business partner with the WRLA offering group benefits savings programs. PIB knows retail hardware and building supply industry and connect with PIB to help you and your employees with proper coverage and EAP support. Oh, sorry guys, I got my mouth full there. Before I introduce our speaker, I just want to let everyone know that this session is being recorded and it's going to be posted on our WRLA website, so you can go back and watch it later. You can ask questions during the session. I'll facilitate them with Mark at the end. So just use below, you'll see a chat function or a Q&A function. I'm going to monitor them for Mark. And I'm also, right when after I finish introducing Mark, I'm going to upload a handout to the chat function that you can download and follow along with Mark as he presents. So I really am excited to welcome Mark Saulnay. Apologies, Mark, from Homewood Health. I knew I would mess that up. Yeah. Mark has close to 30 years experience in the mental health field and has worked in the EAP field for more than 20 years in various capacities, including clinical regional manager, trauma specialist, senior training consultant, and account executive. He's worked with various employee groups, including those in healthcare, transportation, corrections, police, public service, and high-tech industries. Mark is a sought-after workshop facilitators whose clinical and management experience is integral to the delivery of training to employees and management alike. So Mark, I'm going to let you take it away. I'm going to mute myself, go off video, and I'm going to upload that thing so you can take over.
Okay, perfect. So we're just waiting for the presentation to come up?
Yeah, we don't see it yet.
Okay. Oh, I see. I need to bring it back up again. I thought that was, you were able to do it. There we go. Okay.
We can see it. You look good.
Right. Okay. Super. So thank you for that introduction. That saves me having introduced myself, so you get a sense of who I am. I've worked in the employee and family assistance field for 20 years. And so I'm quite aware of what the programs offer. So you've already been told about the relationship with Homewood Health. And so you have your EAP through them. This is the call-in numbers. Probably you have something a little bit different, but the thing to keep in mind is that it's available 24/7. So there's no such thing as having to wait for the office to open at 9 kind of thing. If somebody is in distress, needs to reach the EAP, then they can call any time of day or night. So today's session, basically Stress Busters, kind of says it all. But basically what I'm looking at is we all experience stress in a different way, in a slightly different way. And stress can have an impact on us, not just physically. We may see some of the early warning signs of how it's affecting you physically, but also over time will have an impact emotionally, as well as socially in the way that we behave. So being able to be on top of it and understanding the impact that it's having is really key to be able to perform well at work as well as at home. So today's session is really built on being able to understand how it impacts you, understand that it may be impacting you in a different way than the person right next to you, but also we can all improve to a certain degree in the way that we manage stress. So obviously everybody is doing what they can to be able to manage their stress, but there's always room for improvement. So hopefully today we'll have an opportunity for you to be able to share as well some of the things that you found to be helpful. And I can add to whatever it is that you may have been doing for things for you to consider of adding to your toolbox, so to speak. So really the goal is to become aware of how stress is impacting you. So we'll talk about, what stress is, kind of the definition of that, look at some of the ways that it's impacting you. So some of those early warning signs that you may be seeing, and then have the opportunity to develop skills in order to reduce the stress. So hopefully by the end of the session, you're going to have a good kind of idea of what strategy what you can build or what you can do in addition to what you're already doing in order to better manage stress. So when we think about what stress really is, as to that definition, it's really that emotional, physiological response to anything that we perceive as being threatened. So whether it's real or imagined, the real key word there is perception. So the thing is that our brain has been hardwired, and that hasn't changed over time, that when we perceive threat, it's as if we were being chased by a woolly mammoth. That's all the way back to that time. It was put in as a mechanism in order to keep us safe. That same reaction happens, and the way that we react, that whole chemical composition that dumps into our bodies, is the same as it was way back when we were hunter-gatherers. So we know that the whole idea of the impact of stress can be huge, or it can be something that's quite manageable. So really the equation comes to this, that there are certain demands that are placed upon us. If we feel that the resources at our disposal are up to par, able to meet that demand, then we're not going to be feeling that level of what I prefer to call distress rather than stress. One of the first researchers into stress, Dr. Hans Seeley, and probably misquoting him here, but basically he said, if you're not feeling any stress, check your pulse, you might be dead. And, that is a funny thing to think about, but really what it says is stress is a normal thing, that it's not always bad. Sometimes it's just a call to action that we need to do something. As long as we feel that we have the resources to deal with it and it's not something that's overwhelming us, then it actually motivates us. It gets us out of bed, it improves our self-esteem and being able to handle difficult situations. But when it becomes distress, then that's a different thing. When it becomes something that starts to have a negative impact on our physical selves, and then in turn on how we behave, how we think, how we interact, how we socialize, then that's something we need to build more stress reduction skills around in order to stay healthier and have healthier relationships. So I'd like to open the chat for a bit for people just to let us know from your point of view, what are some of the handout that was posted. You could go with that, or basically I'm just going to go through the content of it. So current stressors in your life, and keep in mind that this is totally anonymous. Nobody can see who's chatting what, so that's protected in that way. But I'd like to open up the chat to folks. Tell me, what are some of the stressors in your life? And I'm sure that there will be a lot of common things that people would be able to share. So let's open up that chat and see what people have to say.
We've got a quiet group, Mark.
No, that's fine. Just give another second here, and I'll fill in, for things if people have. Oh, there we go. So restricted movements due to COVID, right? So a lot of people can relate to that for sure. Different responsibilities, family responsibilities, management responsibilities, fear, sure, affecting others. So I think this, particularly young kids and the elderly, running business through a pandemic, definitely. Okay. So certainly we've seen a lot through this pandemic of people being very challenging, trying to keep a balance because of all the changes that have been there. So being able to cover for staff who are working from home, the whole idea of when people started working from home and the challenges that that brought up. I heard a lot of people say, you know, how do you manage having the kids at home doing their schoolwork from home? Well, at the same time, you're trying to run your office, so to speak. Well, trying to manage the kids and trying to come to some kind of arrangement with the kids as to when you could be disturbed, when you're available to them, and when you're not. But common stressors within the Employee and Family Assistance Program, pre-pandemic, tended to be one of the first things was personal stress, why people were calling in for help. And personal stress could be a whole bunch of different things, about having disagreements with our partners, about childcare issues, about financial issues, on and on and on. Communication, couple communication issues tend to be a major stressor for people calling in. Oftentimes, these are the reasons that they would call in for. Financial issues, on and on and on. Basically, life demands, which are totally normal, and hopefully bring us to a reaction whereby we're able to meet the demand and not causing distress. But when it starts to cause distress, then it can really start to, in a sense, play havoc with us if we don't do something about it. So when you think about the impact of stress, and again, I'm going to open the chat for folks to be able to tell us about what are some of the early warning signs for you in all of these categories. But I want to start by saying, if there was a fire, we would call 911. But when we see these signs that can be actually quite dramatic in some cases of the impact of stress on our physical selves, emotional, social, behavioral, we tend not to do anything about it, not to reach out for help or to self-medicate as a way of dealing with the stress. So really, the call to action is if you're feeling, if you're witnessing any of the signs that we're going to be talking about, then this is an invitation to reach out to a resource that can help you with that, or to build a plan around how to better counteract the demands that are there or meet those demands. So let's open up the chat again. And this time I'll let Jessica monitor that chat, and we can comment about it. But let's start with the physical. What are some of the things that you've noticed in your lifetime that would be an indication that stress is starting to have a negative impact on you? So let's start with the physical. What are some of those physical signs of stress?
We've got headaches and lack of sleep, weight loss, weight gain,
Yeah.
fatigue,
Yes.
Okay, thanks everyone.
Okay, yeah, so I've heard it said from family physicians that up to 70% of their visits, when they were doing in-person visits, had to do with what they believed were linked to unresolved stress issues. So people going in, with stomach aches, with back aches, with not being able to sleep properly, people going in with indigestion, et cetera, that when they went back into history, they realized it was unresolved stress issues, up to 70% of visits to a family physician. Somehow that kind of surprises me, but then it doesn't really surprise me, because you can see, we'll talk a little bit about the physiology of stress and those hormones that dump into our system, that if it's going on for too long, eventually we'll start to have a negative impact physically on our bodies. So let's open up the chat again and talk a little bit more about the mental and emotional. What are some of the things that you've noticed in yourself or in others that would be a sign of unresolved stress issues at play? Now I'll give it over to Jessica to
I've just posted
monitor.
it in the chat.
Okay,
I just put, what are some mental or emotional signs of stress, Mark, in the
right.
chat function?
Okay,
Cranky. That's a good one.
yes, yeah,
Insomnia,
yeah,
crying, brain fog.
yeah,
Not sure if overeating,
mm-hmm,
depressed,
yeah,
unable to focus,
yes,
forgetfulness.
yes,
These are great.
yeah, yeah. And very much in keeping with what most people would say as reactions. So if the stress becomes unresolved for a longer period of time, then it wouldn't be unusual for it to develop into more of an emotional reaction to things. So certainly, being cranky, flying off the handle easily, those types of things. I know in my past that sometimes I wouldn't notice the signs, but someone close to me would say, "Hey, Mark, what's up? You seem to be a little on the edge these days." And I'd have to reflect on that and think, okay, so what's going on here? What is it that I'm not looking at? What is it that's going on? What do I need to do about that? So sometimes it's those that are closest to us that see the reactions. We're not necessarily the first ones, but it's important to be kind of aware so that we can see it and try to do something about it. And if we're struggling with finding a plan, then reaching out to the employee assistance program, reaching out to friends, neighbors, whatever, in order to get a better plan together. So those mental, emotional things can happen along with the physical. Usually it's over a longer period of time, but if left unresolved, there is a fair body of literature that shows the link between unresolved stress issues and mood disorders, primarily anxiety and depression. So these are very real things. So really we need to stay on top of it in order to stay healthy and being able to function. So when you think about brain fog, being forgetful, all of that stuff, that is an indication that it's impacting our ability to function well. And so it's critical that we do something about it to avoid making mistakes, to be able to build better relationships, on and on and on. So let's look at the social relational piece. Let's open up the chat to that as well.
All right, I'm typing in there. So we are looking for social and relational signs of stress. Removal from yourself from social interactions.
Yeah.
Introverted.
Mm-hmm.
Alcohol abuse.
Yeah. Outburst. Yeah. Okay. Yeah. Well, thank you for that. I mean, those are right on. I mean, oftentimes people that are feeling overwhelmed, overstressed, they will remove themselves from social interactions, so they'll isolate themselves, when in fact, probably the reverse is really what's needed, is to be able to reach out to people, because we don't need to be dumping on ourselves because we're being impacted by stress, but sometimes reaching out to people, being able to talk about what our stressors are, is really part of the solution. So that whole idea of becoming introverted rather than reaching out is a big part of that. So sometimes it's exactly the opposite of what we really should be doing. Those emotional outbursts certainly has an impact on your social relationships. People tend to want to avoid us. And so we kind of create a bubble around us. People are afraid of us in a sense. So if that starts to happen, we need to be aware of the dynamic that that is setting up and be able to do something different. And the whole idea of the needing to have social relations is really key to finding solutions. So alcohol abuse, when I go back and say what I said at the beginning, that oftentimes if our house was on fire, we'd call 911. But when we see these early warning signs of stress, what we tend to do is not put a plan together, not deal with it, or try to self-medicate. And then that just works against our efforts. It doesn't actually help the issue, it actually worsens it. And so let's open it up again to that last piece, behavioral. I think we may have hit on some of those already, but what are some of the additional behavioral signs?
Critical of others,
Ah, yes.
withdrawal from others,
Yep.
critical of ourselves as well.
Yes. Yeah. Yeah. Well, that's great. I mean, not great, but that's exactly right on. And I'll be talking a bit later on about what we call crooked thinking habits. That as we're under stress and we start developing this habit of being super judgmental of others. So we become very judgmental of others and their behaviors, or really judgmental of ourselves. So it's not just about others, and then withdrawing rather than reaching out. So all of those basically fit that kind of dynamic. So being able to understand, how this stress response happens. So as I said earlier on, much like the woolly mammoth, that there can be a stressful event. What's really key is it's that perception. So if we perceive that there's a danger, then it's going to kick in that chemical response. But oftentimes, if we're able to challenge our perception, that can prevent this whole cycle from kicking in. So for example, let's say, my boss wants to see me in his office. Obviously, we're going back in time, but if that was the event, so my boss says, as soon as you're back from lunch, I'd like to see you in my office. If my perception is, whoa, boy, what have I done wrong? I must have done something wrong. Well, then that is going to flag, that's going to kick in that whole chemical soup, that chemical response that dumps. And then I go through all of that. If I challenge it and say, well, what makes you think that you've done something wrong? You've been doing fine. So maybe there's an opportunity. So we can change things at that point of perception. And it's just that fight or flight. So it's really being able to see, is there actually a threat here? And oftentimes we can stop it in its tracks right at that perception and look for something that's more reasonable. And then we don't go through all of this. But if it does kick in, then what's going to happen is you have this chemical response. So I like to call it a chemical soup. Basically kicks in, preparing for us to be able to fight, flight, and some people say fight, flight, or freeze, because that's an option that can happen as well in these highly stressful times. So when that chemical response kicks in, then that is why we have that physical and emotional response. And that leads to the decisions that we make, the behaviors that we engage in. So we're going to look at this a bit more in depth, but I just wanted to highlight the fact that perception is really key. And oftentimes we can avoid that whole chemical reaction simply by looking for a better reason or a better understanding of what's going on, and to see whether we should actually be concerned, whether there's actually a threat there. So sometimes it could be an email that we get and we're not too sure, it seems to have a bit of a flavor to it, but we're not sure if we're being attacked or not. That same chemical reaction can dump in as soon as that happens. So we can challenge the perception and say, well, wait a minute, is that really what's going on? Am I misinterpreting this? Or is there really something that I should be concerned about? And then maybe I want to pick up the phone and talk to the person rather than try to understand the tone of the email through the writing. So we were built to be able to have that fight or flight response. The idea is that over time, basically stress is meant to be short-term in nature. So as I said earlier with Hans Seeley, if you're not feeling any stress, check your pulse. The idea is that stresses are going to happen, but when they do, there's kind of a higher level of stress as that curve goes up, but able to get back into that recovery zone. So we're not always under a high level of demand. So we're able to use whatever relaxation techniques, or just take a break, or enjoy ourselves, enjoy family, friends, et cetera, and then we're ready for the next event that may happen, but we're able to get back in to that recovery zone. And we will talk about how to get to the recovery zone, even in super stressful times. Now, the thing is in today's reality, and certainly with COVID that's been going on for so many months now, that the continuous demands being placed upon us may put us in a position where we haven't been able to get back to that recovery zone as quickly as we really like to. So we really need to be able to look at how can I get into that recovery zone, especially in times like this where it's particularly stressful. So we don't want to be suffering the negative consequences of ongoing stress over a long period of time. So what we want to be able to do is to be able to manage stress, and we'll go through in more detail. In the handout that you have as well, you'll see on the back page, there's these 3 key strategies, and then there's a bit of a plan that you can work on, but we'll work through that. So one thing is, first, changing the situation, but how to better manage the stress. And I'll go through more detail on that. As I've been kind of talking about, our perception of the event. Is there another way that I can explain how I'm seeing it? And then third, kind of behaviorally, how can I behave in a different way? How can I change in how I react? Now, this perception thing, I wanted to talk a little bit more about that. There's a lot of research over the years has looked at stress, chronic stress over long periods of time, unresolved, that would lead to not being able to perform well at work, not being able to be as successful, and dying sooner. So more disease, et cetera, et cetera. 5, 6 years ago, I think it was, there's a researcher called Kelly McGonigal, and there's actually a TED Talk if you're interested. But she had done a longitudinal study, and I think it was about 10,000 people. And they asked several questions, about the level of stress that people were feeling, et cetera, et cetera, et cetera. They ran the numbers and they looked at those that had identified being under a high level of stress for a long period of time, kind of fit that dynamic of not being as resourceful, not being as successful in their careers, getting sick more often, and dying sooner. Then one of the researchers suggested, let's go back through the data, identify those that have said that they have a high level of stress on a regular basis, but who do not perceive stress as being a negative thing. Change it completely. What they saw was that people that were under high levels, said that they were under high level of stress on a regular basis, but did not see it as a challenge to their well-being, but saw it as something that could be overcome, were actually more successful in their careers, were healthier, and lived longer. So the whole idea of the perception of whether we see it as something that's overwhelming us or not, when they went even further, what they realized was that individuals that have that perception of, it gave them more self-esteem, they're better able to manage situations, and they're more willing to help others in the same situation find solutions to their issues. So really turned the research on its head. So important to keep that in mind, that the perception can really be key. And as I say, there is a TED Talk, and her name is Kelly McGonigal. So changing the situation. Here are some ideas. And as I go through these, I'd like you to be thinking in terms of the current stressors in your life that you've already identified, and see if any of the things in these three categories can be applied to putting a plan together for yourself. So many of these, I'm sure you've already done. Some probably have had a good effect, good impact. Others, maybe you haven't tried and you may want to consider. So the first thing is to prioritize. So let's open the chat. And what I'd like to do is to tell me, how might that change your situation? You know, how might that reduce your stress if you were to prioritize? How would that actually apply?
I put that into the chat there for you, Mark.
Okay.
I know for me, it makes me feel like I'm in control of something.
Yeah, yeah. Okay, so I mean, if we were able to look at everything on your list of what needs to be done, and you're able to identify, okay, well, what's the first priority, then you're taking action, you're doing something. So it allows you to focus on one thing at a time. Perfect.
Yeah.
Says it all right there. So sometimes we feel overwhelmed that we have to take charge of everything, that we have to make decisions about 100 million things that are on our plate. But being able to say, okay, what's most important? What do I have to do now? And as this person is suggesting here, you know, gives you the short-term goals, puts you at ease when you know what's taken care of. I know one of the things that I learned over my career was being able to identify what was the most challenging thing, what was the thing that I was avoiding the most, and then prioritize that as that's the one I have to get to first. Because if I kept burying it, putting it aside, it was just building up, and it felt like insurmountable. So a challenge for me, what worked well was prioritize, look at the thing that I'm finding to be the most overwhelming, or what I'm really trying to avoid, and do that. So I just throw that out there, but at least taking action, feeling in some kind of control. So let's do the same thing with negotiate. How might that change the situation? How might that alleviate some stress? So if we could put that in the chat.
You got it. I'm just thinking, how can negotiation reduce stress?
Yeah.
All right, that's in the chat, guys. We don't have anybody responding to that one.
Yeah,
So
no,
that's interesting about negotiation. Oh, we're trade-off jobs with someone.
Yeah.
Trade-off jobs with someone so you don't feel like you are doing it all.
Yeah.
An opportunity to talk it out. That's a great one.
Yeah. And so being able to, you know, like I'm thinking someone that used to support me, that if I had another project and went to the individual and said, we need to work on this, she was great at negotiating, saying, well, okay, that's fine. So, you know, let's spend some time talking about that, but tell me what I can take off my plate or what can go on hold so that we can focus on this now. So being able to take control, or, you know, being able to talk it out in that way, showing a willingness to want to roll up our sleeves and work together, but being able to negotiate, okay, so then what can go on the back burner for a while, or what responsibilities can somebody else take on? So that's great. So let's try the same thing with delegate. how would that change the situation? How might that reduce stress?
Okay, that question is up. How can delegation reduce stress? Lighten the load?
Yeah.
Sharing the workload? I know for me, it's not feeling like I'm in it alone sometimes too.
Mm-hmm. The key with delegation too is to be able to let go and let the other one do it in their own way. So if we delegate responsibility to somebody else, then we should be able to have a conversation, set the expectations, provide training that may be needed in order to do it, and then let it go so that you have really delegated and you're not holding on to it and micromanaging the person. You actually have traded that one off to somebody else.
I've got some great answers. A way of asking for help by delegating, knowing your strengths, and a team effort.
Yeah. Yeah, that's great. Good. Now, these might be not obvious, but it could be as well, but changing the situation by starting something. So let's put that in the chat and see what response that we get from there.
Okay, that's right. Changing the situation by starting something.
Yeah.
It's like a reset kind of, Mark. Is that kind of what you feel like? That feels like a reset of a situation, or could it be? Putting it in perspective. Oh, someone's here.
Yeah,
This seems less daunting.
right. So by actually rolling up your sleeves and just starting to do something. The other way that I tend to look at, start doing something different. You know, that definition of insanity is doing the same thing over and over again and expecting a different result. Actually start doing something totally different. Approach it from a different angle. Could be another way of interpreting that starting, you know, starting to do it in a different way. And the same would go with stopping. If there's something that I keep doing that's not getting the results that I want, then stopping doing that. Sometimes it's about having to change the way that we approach it so that that can stop it. So let's open up the chat to this last bullet of change. So how would changing our approach change the situation, alleviate stress? Yes, breaking new habits.
Sorry, Mark, I just put that question up right now.
Yep.
How would changing approach change the situation or reduce stress?
Yes.
Perhaps it's a fresh perspective.
Mm-hmm. Doing something different. So I can give you an example around that. At one point, I was particularly challenged because I'd taken on several new responsibilities, some new accounts while still keeping other things. You know, I wasn't able to delegate other things. And I was noticing some of the signs of stress. And so I needed to find a way to get to that relaxation zone. So the thing that I changed is this, is I've been a practitioner of Taoist Tai Chi for 20 years now. And they had a fundraiser, and the fundraiser was kind of funny. He said, donate $10 and every day practice what we call standing jogs for 10 minutes every day. And so it's a way of rewarding yourself. Well, that was 5 years ago, and I do it to this day. So taking that time of changing my morning routine to make sure that I took that 10 minutes just for those exercises, and that had the impact of reducing my stress, of being able to get me into that relaxation zone and be in a better position every day to deal with the stresses that were there. So for me, it was about changing the morning routine. So apply that how you like, but you may find that in your own patterns, that there are certain things that you can change to be able to benefit you, whether that's changing it to making sure that you have regular conversations with your partner, spending time with the kids, however it's going to be, but changing something in your routine can also be something to consider. That sometimes that is within our control. So really all of this, they're all examples of things where we don't have to be bystanders to how stress is impacting us. We don't have to be victims to it, but we can find ways to actually take action and change the situation. So looking at the idea of changing the situation, sometimes you just need to look at it in this way. So, what is the situation meeting? How else can you meet that need? So just as an example, I might throw out somebody, let's say commuting time. It used to be a big issue. It's not now, but it's going to come back to that anyhow. So I could ask myself, well, what is that commuting? What need is that meeting? Well, it's getting me to work. Well, are there other ways that I can get to work? How else could I meet it? Could I be doing some sharing rides with people? Could I be taking the bus? Could I be taking public transit? Could I negotiate with my supervisor to work from home 3 days a week, et cetera, et cetera. So just looking at what the need is and then being able to see whether we could meet it in a different way. So carpooling, moving closer to the office, these types of things. So another way of looking at changing the situation. Now, of the three things that we talked about, the strategies, one was changing the situation, the other is changing your perception. And I talked a lot about, if we're able to change your perception as to whether there actually is a threat there or not, then it could short circuit that whole stress reaction, that chemical reaction and all of that. So sometimes it's these thinking traps that we have that really get in the way. So our attitudes towards something can really have an impact on that stress response. And we all have these kind of traps, one or several of these. Look at this, and as I go through and explain it a little bit more, identify which ones you're more prone to fall into as far as a trap. And you may want to actually build your strategy around avoiding those traps. So snap judgments, coming to conclusions with very little information. So just a snap judgment, I don't have this full picture, but I make that judgment, act accordingly, and it ends up causing more stress. And I don't have a better understanding of what's going on. Predisposition could be because of my history that I expect to see certain things, and so that's all that I see. Or I expect for people to act a certain way, and so that's all that I'm aware of. So I've got this awareness, this predisposition of seeing situations and people just always being that way. So that could be another trap as well. Personalization is really about always taking it personally. So, somebody comes in the office, they're in a grumpy mood. If it's my boss coming in the office in a grumpy mood, and I ask myself, well, what did I do wrong? Well, probably it has nothing to do with me. So that whole personalization of taking it, it's about me. So this could be, work related, it could be family related as well, but it's basically misinterpreting the situation by thinking that it's about me when oftentimes it has nothing to do with me whatsoever. So communication is really key. Catastrophizing, taking a situation and making it as negative as one possibly can. We're never going to get through this, et cetera, et cetera. So another thinking trap that you might fall into. The whole idea of magnification, minimization. So magnifying the worst in what is happening and minimizing the good things that may be happening is another trap that we can fall into. And that kind of falls into that overgeneralization of taking, one piece of information and it's always this way. So, overgeneralization could be, oh, you can't trust the politician, they're all the same. Rather than recognizing that they're individuals. And the same with, it could be, all bosses are the same, all CEOs are the same. Overgeneralizing rather than seeing the uniqueness of the situation. Fortune telling, again, kind of looking at that catastrophizing piece of taking one piece of information and taking the most negative view of it and predicting what the future it holds is that fortune telling. All or nothing is basically a way of looking at the world that's black and white and not seeing any shades of gray. So as I say, if you see yourself in any of these traps, there are some that you fall into more easily, then ask yourself, how much stress is that causing you? And can you see it in a different way? Disqualifying the positive, always just looking for the negative, but not seeing the power of the positive. And the should statements really having more to do with people should be this way. I should be this way. So somebody mentioned earlier in one of the chats, of being super critical of others or of ourselves. Oftentimes that's through those should statements of the world should be this way. People should be that way. A good neighbor doesn't act that way, et cetera, et cetera. So other ways to be able to change, these are ways we can change our perception so that whole chemical soup, that whole reaction doesn't happen. And we're able to kind of nip it in the bud and look for something that is more reasonable as to be what might be going on here. Now, looking at changing how you react, which is the second way. So just before I go there, this idea of changing how you look at the situation, another way to be able to frame it is find the things in the situation that are within your control, or at least that you have some influence over, and then focus on those. So you're actually able to put your energy where it has the most impact. A lot of times we focus our energies in areas where we have no influence, no control, and we end up burning out because our energy is going towards areas where we really can't make a difference. So if we're able to look at the situation, ask ourselves, what within all of my concerns, what items are in there where I have a degree of influence or a degree of control, and then be able to focus on those areas. So changing how you react, some ideas around that. If we want to stop, start, or change a certain behavior, then here's ways to be able to do it. So that example that I gave you about the 10 minutes of my standing jogs in the morning. So that changed my morning routine. But think of this in changing how you react to the stressors that you have identified. So the first starts with, think, get a visual picture of the way that you're doing it now and how you would want it to be different. So visualize your current way and your new way. So look at that. And then make sure that you identify small achievable goals. So small bite-sized pieces. And then look at, because this is how our brain works, is committing to 21 days of practice. Because the first 7 days helps us to kind of get in with rhythm. The following 7 days start to establish that. And then after 21 days, it's a new habit. So that's the concept behind that. And it's always helpful to look at kind of the reward system as well, right? So how are you going to measure success, and how are you going to reward yourself for having achieved that success? And remember that if you make mistakes, to just stay with it. Don't give up. Just be easy on yourself. Forgive yourself for it. Start over again. So go back basically to number one. So visualize what it is, your new way, what you want it to be. Learn from how you may have made mistakes. Maybe you need to adjust those small goals. Make sure that they're concrete. Again, go through that whole cycle. So changing how you react to it. So the idea of building on that, how you behave in the situation, is being able to realize that you're worth it. In the sense, you are number one. You can empower yourself. You are in control of much of what you do. And so look at those areas that are within your control, within your influence, and give yourself the encouragement, empower yourself to do something, to not be a victim to the stress. And make sure that you're setting boundaries around self-respecting boundaries, being able to say no to people's requests, being able to negotiate, being able to have conversations, and being able to create those choices for yourself that is in line with where you want to go, and being able to seek the solutions that are there for you. So being able to change your behaviors, being able to change your habits around there. So I'd like to open up the chat a little bit. Just give me some feedback on some of the more recent things that I've shared with you, and tell me how that might apply to the current stressors that you identified. So specifically looking how the thinking traps may be a part of the issue that's causing the stress, and looking at how you can change your behaviors in the situation. So let's try that for a chat.
Sure. I just put up how about some of the items mentioned might apply to the current situations.
Mm-hmm.
I appreciate the reminder that we are in charge of the change ourselves.
Right. Yeah.
That's an important one for me.
Yes, yes. Okay, so you will be getting copies of the slide deck as well, and you'll have copies of that worksheet. So keep in mind, if you go back and you're doing that plan, that many of the things I talked about could fill in that plan that you'll be making.
Absolutely, and we'll send out a link to the video of this too, so they can watch it as well.
Right, good.
We did have somebody mention that engage staff, motivate staff, and retain staff.
Wow, yeah. So looking at other, modifying behavior, as I said at the beginning, oftentimes when we're under a lot of stress, we ignore it, or we self-medicate, or we do exactly the opposite of what is required in order to live more healthily and deal with the stress. So these are key areas. Getting sleep. So the whole idea of being able to get to that REM state of sleep, it's a 90-minute cycle. And what's recommended is 4 to 5 cycles in a night for you to be able to get to that restful sleep where your brain has the opportunity to repair itself, to be healthy. So sleep is really key. And if you're looking for ideas, there's lots of books there. You can call the EAP as well, but getting a good, healthy sleep is really key. So there's, as I said, make sure that the room is dark, that it's not too warm. Don't be drinking caffeine before going to bed. Don't get into heavy discussions and arguments, all these things. As I say, there's lots there, but being able to get good, healthy sleep is really key to having a healthy, productive life. Eating well. Often when under stress, we go towards the junk food, we go towards the things that are high in fat, sugar, salt. when in fact, what we really need to keep our body healthy is healthy eating. Again, your EFAP program offers nutritional services. So if you wanted to speak with a dietitian and nutritionist, I should say, then you can call them around that. Exercise. A lot of people say, well, there's tons of evidence out there that 30 minutes of exercise a day, at least 5 days a week, has a huge impact, not just on physical health, but emotional, psychological health. But it's helped people with diabetes as much as it's helped people with depression and anxiety. 30 minutes may sound like a long time. Even if it's 5 minutes, 5 minutes is better than 0 minutes. The ideal is 30 minutes, 5 days a week. And then, of course, the moderate alcohol drug intake is being able to be more healthy. So here's one of the nuggets, is that when we're in a state of relaxation, we cannot be stressed. You can't be stressed and relaxed at the same time. So whatever it is that you're able to do to get you into that state of relaxation, then that's what you need to go towards in order to stay healthy. So think in terms of what you have perhaps done in the past that helped you to get to that relaxed state. And if it's something that you can reintroduce, or think into things that you know help you and build it into your schedule to do those things. One easy way to do it is through breathing. So we don't have time to actually go through this, but I'll describe to you one way of breathing that I found to be particularly helpful. As a beginner to meditation. So all that it was basically taking a deep breath in, and when letting it out at the same pace as I was breathing it in, to count to 1. And then a deep breath in, and as I was letting it out, to count to 2. To go all the way up to 10, and then reverse it. So once I'm at 10, then go deep breath in, on the reverse breath out, 10, then 9, 8. By the time you get to 1, you've done basically 20 rounds. If you were to take your pulse before you started that breathing activity and after, you would notice a difference. So breathing, again, something that is within our control, something that we can always access. And sometimes it just takes 2 or 3 minutes to get to that calm place. The more that we can kick in that relaxation response, the less that stress response can actually be there, be present in our lives. So it really is something that's always accessible to us. There's lots of different activities. There's things that you can download, apps that you can download around breathing activity, meditation. It doesn't have to be a long period of time. 5 minutes can be very effective in being able to get to a calm place. So once you have looked at the video again or downloaded the slides and you have that handout, then you actually have kind of an area of managing my stress, it's called, where you're able to look at, so what are the stressors that you can eliminate, modify, or alter? What think your feeling habits can you change? What behavioral habits can you change? What can I do to help relax myself? So that's basically something for you as a takeaway. So what we've done is we looked basically at ways to be able to manage your stress. We looked at situations. We looked at how perception is really key to that, how you can change your reactions, your behaviors. And really the key is take time to relax, even if it's just for a few minutes every day, and look for those opportunities, actually seek them out. So I'd like to open it up to kind of a Q&A.
Wonderful. Thank you so much, Mark. So please use the chat function or the Q&A function to ask Mark any questions. I'm going to kick one off, which is what tends to be the first earliest warning sign that you are under stress? Did I freeze? Can you hear me, Mark?
Yeah, I sure can.
Okay, sorry. The first question I wanted to just let everyone know that you can ask questions in the Q&A. And that my first question is, what do you feel is the first earliest warning sign that you might be under some stress? If anybody has any questions, you can put them in the chat function or the Q&A function. Mark, do you believe stress is always a negative thing?
No, I think oftentimes it can be very motivating and increase our self-esteem by being able to accomplish the task at hand. It's whether we feel that it's overwhelming or not.
Okay. And what do you think is the best stress busting strategy? I mean, you mentioned your sorry, I'm gonna get it wrong. Not Tai Chi, your headstands. But what's the best stress busting strategy that worked for you in the past, in addition to the habit that you formed?
Right. So, I mean, a lot of it was around what I like to call stinky thinking. You know, those crooked thinking habits. Of being aware of how that was impacting my self-esteem and being able to really challenge some of that automatic thinking that was going on inside my head that was actually causing me more stress. And when I was able to challenge that, I realized that there are all kinds of opportunities that were right in front of me. But I'm sure everybody online has had their own experience as well with a stress busting strategy that they felt particularly well suited to them. But,
yeah, if anybody wants to share some of their best stress busting, my personal ones is I've found several podcasts that I like to listen to with relaxing NPR voices that I drive to and from work with, and chill me out before I start as I leave work. That's my stress buster.
Yeah.
If anybody has some tips, pop them in the chat. Absolutely. Yeah, it definitely, we all need to find our methods. If anybody has any great stress buster tips for us that they have had success with, please throw them in the chat and I'll read them out loud. Like I said, my favorite is podcast. I haven't downloaded any meditation or breathing apps, so that's actually a great idea. Probably not meditation while I drive. Oh, there's a good one. Going for a run or a walk. Yeah, that's great. Those are good ones. Walking my dog is another one.
Yeah. But, you know, you talk about breathing exercises where you're driving or meditation where you're driving. You can do breathing where you're driving. You know, you can be aware of your breath and certainly just be sure that you're breathing properly, right?
Very good point. Keeps you calm in the traffic sometimes too, right?
Yeah.
Somebody has mentioned getting outside for a lunch break or even just a few minutes to clear your mind. That's a great tip. Actually, physically leaving the space that you're in, right?
Yeah, exactly.
Those are great.
What I found through this COVID-19 is that a lot of people that would normally be commuting to the office, and instead they were at home, instead of using that time for themselves, they would just start work earlier.
Yes, I did
so
that.
They expanded their day rather than take the time to actually, you know, rejoice in the fact they didn't have to drive.
Yeah. Just think you can get more done. That's great. Well, thank you so much, Mark. I just want to thank you so much. This was a wonderful session. And I want to thank everybody who participated in the chats today for being willing to put yourself out there and give an answer to Mark who's asking the questions. I know sometimes it's hard to do that, but we really appreciate the interactiveness of this. And thank you for the great tips at the end too about what you do to bust stress. This session, as I said, is being recorded. I'm going to put the link. Mark has provided me with the handouts and the slides, and I will send those all out once the link is ready for you to watch. I want to thank our presenter PIB today. If you have any questions about the EAP program, I'm going to be providing 3 of the contacts for the different regions for the WRLA, so you can reach out to them for more information on the program. Mark, thank you so much for being with us. Thank you for spending time with us today. I really enjoyed this session today, and I think everybody else did too.
Great.
Thank you so